I do want to call out just the great work of the associates at Johnson & Johnson. It was a really strong first quarter that enabled us to maintain our guidance, but there's a lot to really unpack there as we're covering some headwinds, such as dilution from a great acquisition we just made a few weeks back of 25 cents. And then we did account for tariffs to the tune of about $400 million or 15 cents approximately, but still maintaining the 1060 midpoint. What we've assumed in that $400 million is the tariffs that are in place today and the timeline on which that corresponds to those programs. So that is largely med tech, and that would include any items not exempted under USMCA. That would cover some aluminum and steel tariffs that apply in some of our med tech business. And then it also includes the China tariffs as well as the retaliatory tariffs from China. And that is probably the biggest component. 70 to 75% of that $400 million relates to that one component alone. So think about that. Those are products that have an origin here in the U.S. that are being sold into China. We'll have to see with pharmaceutical tariffs. The news came out last night about Section 232 with respect to national security interests. I think when you look at what actually makes up the landscape of pharmaceuticals and maybe countries of interest under that provision, it would lead you to believe that it's mostly generics. And 90% of prescriptions in the U.S. are generic today. The other factor it could be is what they call precursor type of ingredients, so hydrochloric acid, magnesium, products that synthesize the active pharmaceutical ingredient to kind of keep the pill together and make the biologic work. So we'll have to see where it plays out. Nothing in our estimates right now assumes a pharmaceutical tariff, but we continue to monitor the situation and speak to the administration, who's engaged with us on a regular basis to get our thoughts and views on a number of items. If you really want to bring jobs back, I think it really comes to the tax policy. And if you think about the $55 billion that we were able to commit to just in recent weeks, we were proud to do that because it houses our products in the system of innovation, great education system, and at the end of that $55 billion investment, all the advanced therapeutics from Johnson & Johnson will actually be able to be produced and sold here in the U.S.
So, Joe, I hear what you're saying. Just to follow up, so on the $400 million tariff expense that you accounted for in 2025, it doesn't include the investigation we've been talking about. How could it? We don't know what's going to happen. I want to just follow up on your last point that you made, because it's something that I've been wondering. I mean, how do you incentivize bringing manufacturing back to the United States? It sounds like you're saying that tax incentives would cause you to do it more so than punitive tariffs.
Well, let's look what happened since really the passage of 2017 TCJA. Right, the biopharmaceutical industry in 2016 had about 1,000, maybe 1,100 manufacturing sites across the country. Today, according to the Washington Tax and Public Policy Group, biopharma facilities total about 1,600. Right, so the tax impact of having a 21% corporate rate, which again isn't significantly advantaged, but it's no longer disadvantaged to the prior 35% rate that existed, provided the opportunity for us to house some of the cutting-edge technology in both pharmaceuticals as well as med tech here in the United States. And I think we have to really have a focused conversation about the next dollar invested. If we bring back some of these products, they'll be close to the end of patent life, and probably there'll be better standards of care that currently exist. If we're going to maintain our reputation and our stronghold as the leading country with respect to healthcare innovation, elevating the standard of care every couple of years, I think that's an important aspect that we've got to consider with respect to tax policy.
When you're thinking about the tariff impacts, and even on your earnings call, you had so many investors trying to parse through the fine-tooth details, some of which that don't quite exist yet. You had mentioned the impact to generics relative to other brand name drugs, but if you do see an impact on generics, isn't there a daisy chain, a ripple effect there in terms of affordability of drugs in the United States and where people end up spending their dollars, where insurers end up spending their dollars?
Yes, Sonali, I think that's something that needs to be considered. I'm pretty confident, certainly the industry, and I don't think the administration wants to have people go without drugs that are necessary, essential drugs, if you will. In terms of the price increase, I would have the same conversation that we've probably had a couple quarters in a row now when we talk about pharmaceutical pricing. 60% almost of list price goes to discounting and rebates. Yet those discounts and rebates aren't ending up in the hands of the patient or the consumer that they're intended for. So the middlemen, which you've heard from the administration, some talk around that, having a transparent, following that dollar, where does it go? In our business, particularly for pharmaceuticals, we have no price leverage, right? Our average decline in prices over the last 5 years has been about 3 to 4% each and every year. So the discounts
I'll tell you what,
continue to
Joe,
go up.
I pay a lot less for drugs when I lived in Germany, a hell of a lot less, and when I lived in the UK as well. So we're doing something wrong in this country with regards to what you guys are charging customers.
The one thing I would say about those same countries, Matt,
I want to ask you about tariffs specifically. Joe, I want to ask you about tariffs. If we look at a 25% tariff, and we've seen that big round number on other big industries, would you pull your forecast at that point, or would you still be able to keep it?
Matt, in times like this, we kind of come back to knowing who we are, right? And so we're one of the world's largest healthcare companies. We think we almost have a responsibility on days like this to tell the street what we know and what we don't know. We did the same thing in COVID. It worked extremely well. I think investors appreciate that transparency. It's too speculative to say what we may or may not do on a hypothetical at this point, but we're going to try to be as transparent with the investment community so that they understand what our positions are and what we may be doing to mitigate any impacts from a potential tariff.
Well, let's talk about mitigating. Again, so many unknowns out there. I know that you're awaiting for the results of that investigation, which just began, but have you taken any defensive actions? Have you thought about stockpiling some of the drugs that you have made overseas, or what does that mitigation decision tree look like?
Yeah, we've looked at putting inventory here in the United States, but we were already pretty, I'd say, maximized and efficient with respect to how we conduct our supply chain. We're not going to make rash decisions on 3 weeks of rhetoric, quite frankly. We think about not just the next 3 quarters, not even the next 3 years. We're trying to build capabilities and put facilities that will enhance our capabilities to elevate that standard of care for patients over the next 30 years. And that's kind of how we approach it at Johnson & Johnson.